of the AIDS Action Committee of Massachusetts. I've been doing this work in Massachusetts for about 9 years as the CEO, and about 5 years before that as a board member. So I've long been committed to this issue, as many of you have. And I just want to, I see Dr. Bruce Walker, obviously your fearless leader here today, and he and I have worked together for many, many years, and hats off to him and to the Institute for the work that you do, because you are the future. You are really the end of the epidemic sitting in this room. So the work you're doing is really, really critical. So first and foremost, thank you all for your intelligence and your curiosity. And I have every confidence that someone sitting in this room today will be the person who will finally come up with a vaccine for this terrible epidemic. As I look around the room, I think, some of us, but maybe not many of us, remember the early years of this epidemic, in which we lost many, many friends. In the early years, at AIDS Action alone, we lost about 30 clients a month. And I think sometimes we forget that we as a developed country are not really that much further along than many of the underdeveloped countries around the world in some of this. For those of you who don't know, the new infection rate for HIV in Washington, D.C. is higher than in Port-au-Prince, Haiti. And in pockets of this country, it is like an underdeveloped world in terms of access to medical care, access to social services, access to what would be expected in a country like this just to be able to live with the disease. And I feel very lucky, as do many of the people that I talk to, that we happen to sit in a social service laboratory called Massachusetts. Because here we actually are making a difference in HIV and AIDS. And I'm convinced that until you all can find the medical interventions that were really in this epidemic, Massachusetts represents the sort of social service experiment that is likely to come closest to being able to slow down and stop this epidemic short of a vaccine or a cure. And this is why, because in Massachusetts in the last 10 years, we reduced new HIV infections by 54%. 54%. That's meant we've saved $2 billion in healthcare costs that I'm hoping can be redirected to people who are still out there not in care and not getting the kind of care that they need. And the way we do that is three things in Massachusetts. One is that technically people have access to healthcare here. And it astonishes me sometimes the debate that goes on around the country. It doesn't matter if you call it the Affordable Care Act. It doesn't matter what you call it. It's not about a specific piece of legislation. It's about the idea that in one of the richest and most developed countries in the world, we actually question whether we should have access to health care for all of our citizens and all of those who live in our country. And in Massachusetts, we've given that hope to people by making that available. I'm not saying everybody is still in the system. As many of you know, there are people who are distrustful of the system, who aren't engaged in the system, who have a difficult time engaging with the system. But by and large, we've made access to health care a possibility for people. Secondly, we've created, and this is where AIDS Action Committee is involved, we've created this network of community-based social service systems. For many of you who have worked in Africa or India or other parts of the world, it's not really unlike what many of the villages or communities there are trying to do, which is recognize that if someone is poor or homeless or sick or in a domestic violence relationship, just having access to care and treatment is insufficient for them to really be able to tackle HIV. So what we've created in Massachusetts is this network of community-based organizations. The AIDS Action Committee is the largest. We serve about 1/6 of all people in Massachusetts living with HIV. We support them with the nutritional supports, transportation to and from, mental health services, whatever they need, substance abuse treatment, whatever they need to be healthy in combination with the medical care. And we serve about 3,300 people a year, and the average income of those 3,300 people is $9,800. So these people would not be able to live healthy, productive lives with just on medication and medical care. They need that support. And then thirdly, we've done really good behavioral interventions in Massachusetts. So we've implemented needle exchange programs. We have pharmacy access in our state, which means you can walk into any Walgreens or CVS or the pharmacy of your choice and buy syringes, clean syringes, for 19 cents. The drug dealers sell them used on the street for $5 to $10. And for those of you who don't know, heroin is cheap these days. And we see more and more young people getting into heroin. And we see young people using steroids. And you would not believe we've actually had young men come in to our AIDS service organizations, HIV positive, who share needles for steroids. So we haven't gotten there yet, but we've made progress. And then we have some new pharmaceutical interventions now, right? So we have the PrEP, we have the PEP, we have a variety of things that we now have in our toolkit to try to reduce the spread of HIV. And so all those things combined together make a difference in Massachusetts. And I believe we can serve as a national and international example of how we can stop this epidemic. But as you know, with your research, we can't do it without the financial resources to support it. So in the same 10-year period that we reduced new infections and actually saved cost, the state HIV and AIDS line item has gone from $52 million to $32 million. So in some ways, we're trying to do more with less. In the same 10-year period, even though we've reduced new infections, there are 6,000 to 8,000 new people in Massachusetts living with HIV. So we relied on private fundraising, and the AIDS Walk is our primary vehicle for that. It's our #1 fundraising event. It's $1 million, which will make a difference in the lives of those 3,300 people. And each and every one of you who walks will make a difference towards that. So my understanding is that the Ragon Institute team to date has raised $105,000 for the AIDS Action Committee, and I think you should give yourself a round of applause for that.
Woo!
And I know the goal this year is 30, so that will be a good stretch goal for you, but I'm confident you can make it, and we are going to do everything we can to provide you with the information, the materials. There's things here on your chairs. There's more materials in the back. Jacoba, who's standing there back there with her iPhone, is going to be around. She's going to be here to help you. And you guys have always been a goal team for us, and we have some extra incentives this year. Fenway Park, which you may or may not know, is celebrating its 100th anniversary this year, has opened up the park and its EMC club to have a party for all of our gold team members who raise $1,000 by May 21st. You get a private tour, VIP tour of Fenway Park. If you've ever wanted to see those locker rooms, now's your opportunity. And we also have other incentives that we're going to be offering you to do online incentives so your folks, give away tickets, give away an iPad, do different things that help your folks get engaged. But most importantly, you all can carry the message. This is what you do. You know how big this epidemic is. You know the impact it can have, not just on the world, but on individual people. And by telling folks this is the work you do, and that you're going one step further, which is not only to find the cure, but to ensure that people living with HIV in your own community and neighborhood have access to the care and treatment they need, that's powerful. The fact that you care is a reason they care. People give money to people. And if you ask them to do that, whether it's $10 or $25 or $100, whatever your friends are capable of, and you tell them this is important work, that makes all the difference in the world. And I can tell you we will be good stewards of that money, and we will do everything we can to ensure that every dollar made from the AIDS Walk goes to making life better for that individual person that may just live right in your neighborhood that you might not even know about. So please help us. I'm here. I'll answer any questions. We'll do anything we can do. We'll come back. We'll go to parties with your friends. Last night, I don't know, maybe next year you guys want to think about this. About 12 hours ago, I was at a drag show in the South End that one of the teams held. And they made $2,500 in dollar tips to the drag queen performers. So it was a great fundraiser. There's lots of fun things you can do. We'll participate in any of them. I did not show up in drag, however, but I was there. helping out. And so if there's anything you can think of, anything we can do to help, but most importantly, thank you, and you are the voices for making this walk successful. Thanks so much.
Last year I did better than I've ever done before. Now I have a lot more. I've been around longer than you, so I have a lot more connections. But what I did was I emailed, basically talking about the work that we're doing. I put an email together talking about that, talking about the critical need for us to keep people alive while we're trying to come up with a solution. And then I attached to the email the transcript of Bob Massey's Grand Rounds called Song in the Night, which is, I think some of you have seen that, and if you haven't, you should, and I'll give it to Christina maybe to pass around to people. But it's this incredibly inspiring story of resilience. Bob Massey's subject 161J, who he was infected with HIV in 1978, became an elite controller, but was unable to control HCV infection, ended up actually having to have a liver transplant. And it's a little vignette of 6 stories about his life, telling pivotal parts of it. And what I found was that people read this thing and just thought, wow, this is just an incredible story, and what we're doing is incredible work trying to do something about this. And I sent it to neighbors, the parents of the kids I grew up with in my neighborhood, and family members, and then other acquaintances, and I was really quite surprised at who wrote back. Now, the whole thing took me probably about 3 hours to craft the whole thing together, to go through my entire email list just to see who I had on there. I think there's something called Facebook, I think, that you guys might have access to lots of people through. But it ended up just getting this enormous response. So people, I think, are anxious to contribute, and there is really an incredible need for this. And what I'm really quite proud of the fact that we're working on trying to come up with an HIV vaccine, but at the same time we're supporting people really in need in the community, and I want us to continue to do that. So thanks very much to AIDS Action for all that they've done, and thanks in advance to all of you.